Hello, everybody. This is another pre-talk to the Knowledge Festival coming up from 16th to 22nd of August. Be there, free live streams on our social media sites. And also, if you want to be part of it in our online conference, then just go to our website to the knowledgefestival.org and be part of it. Also, if you have papers to submit, just go there and do it. Now, today, another great talk that we've been looking forward to with Dr. Nair, who is a professor and head of research at Sant Hiradaram Medical College of Naturopathy and Yogic sciences. For women in Bhopal, sorry, I was distracted, and the director of Indian Academy for Scientific Writing and Research. He was the first head of Research and Development Department of National Institute of Naturopathy, Government of India, and has worked in various collaborative research projects with institutes of repute. He's just in short, a very well-known and renowned researcher in the field of naturopathy and has done nearly 30 research papers reviewed in international journals. And also, he was awarded as a youth icon for the year 2017 by Indian Naturopathy and Yoga Graduates Medical Association for his contributions to the field of research in that field. So he's a noted speaker and also his research areas of interest include fasting, biorhythms, gut flora, medical ozone therapy, and public health. He works as a research consultant for various organizations of repute, so there is no better man to give us an overview of the possibilities in his field. So we're very happy to have him here, and I give it over to you.
Thank you, Esel, for that nice introduction. And first, I would like to congratulate what Open Attempt is doing through this knowledge festival and to bringing in a lot of experts together and keeping the knowledge open. That is a primary thing where everything is charged, even the journals charges for their papers. So it's a nice opportunity for every one of us to be a part of this wonderful initiative. And thank you for inviting me. Hope I'm audible.
Yes.
So let me share my screen. Okay, so I'll be mostly speaking on mental health and immunity and what not is the right topic to speak in this COVID-19, where everyone across the globe is looking for something over immunity or something over mental health in this particular period of COVID-19. Somebody is not on mute. Yeah. So mental health and immunity from a naturopathic perspective, where a lot of supplementations, a lot of vaccinations, a lot of other remedies from different streams of medicine, every expert speaking on different perspective about immunity, different perspective about mental health. This is what is happening across the globe. So we thought this will be a right topic for all of us to discuss and have a collective decision on how we should be proceeding in terms of having good mental health, as well as whether mental health has any implication on immunity per se. So from a naturopathic point of view, we'll be talking on this. So I'll be touching a bit on mental health and the different aspects of immunity, how it is linked towards each other during this entire talk of today. So moving ahead, as you can see, the mind was the most abused topic since long, and scientists were trying to understand what is mind and how mind has an implication on diseases. So initially, mind was treated as a separate entity altogether, which does not have any implication on physical health per se. There are some chats coming in. Am I audible? Okay, fine. Yeah, thank you. Yeah. So if you see, mind was considered as an earlier different perspective long back, and only it was a hardcore psychiatric practice long back. But later, by virtue of wisdom, we came, and the failures we found that found in different juncture, from in failing to identify in treating diabetes mellitus, failing to treat hypertension, failing to treat different kinds of lifestyle disorders over past 2-3 decades. Mind has been identified as an important entity where it has a lot of connections with both physical body as well as the entire nervous systems in our body. So initially, as I told, mind was just a philosophical or psychological concept, and which does not, we do not know that mind as a physical existence. But later, there were a lot of I would say a lot of neuroscientists who has investigated in the component of mind, and this mind has evolved. The mind has evolved as something which is not only just considered with the host defense. It has something to do with more than what is just considered as a philosophical concept. Similarly, if you look into immunity, so when we as a child, or when we were in our medical schools, or in our high schools, we looked immunity into something which if something is attacking us, we have to prevent against those attacks. Largely, we say that as infections or bacteria or viruses around us, and it was just looked as a host defense mechanism. Like anything which is harmful to you, we will be going and defending it against that. And whenever it comes to immune system, we largely acknowledge immune system by white blood cells. However, at the current point of time, the immune system has developed, or immune system has passed its tight jacketed phenomenon of just being a host defense to a particular system where it has something to do with the somatic maintenance, the bodily maintenance and tissue repair. And how these two things are linked together, the mind and the immune system, and how naturopathy medicine per se has a larger role to play in this particular arena is what we'll be discussing today. And if you just go ahead and see the brain and immune system crosstalk, like initially we told like the brain is a separate entity. If you are getting some mental health illness, it is completely treated as a mental health illness. You'll be either on antidepressants or antipsychotic medications, and it is completely treated different. And whereas immune system has nothing to do with this brain, this was the initial concepts. But later, as we advanced in our knowledge, as we advanced, as I told, the failure which we encountered in treating different kind of diseases, which is having a toll on human health, we have identified a crosstalk between the brain and the immune system. So the brain and the immune system receive signals from the same peripheral nervous system. For example, it is not just the bacteria or just the viral infections or any kind of microorganisms which is affecting us. Even the emotions, even the feelings which we have, the perceptions which we have, the hearsay things which we take, the belief system which we have, all affects our peripheral nervous system, which is basically present across the body in the peripheral nervous system, and whatever signals our peripheral immune system is receiving. And it has an important role to play in the brain plasticity. Brain plasticity is nothing but how your brain reacts to certain kind of stimuli, the external stimuli from outside. So this can lead to immune insufficiency also, and which can be later classified into normal behavior, normal cognition, normal mental activity, or normal repair. So anything and everything which is related to the peripheral immune system has a thing to do with our brain as well. So these are the published literature which I am presenting for you over there. As you can see, the first one, how from a normal philosophical background, like mind was something which we have seen only in movies where we exchange thoughts between a hero and heroine. And later it has evolved as something to do with the immune system. And the immune system was a separate entity which is present in our thymus gland, or it is present in our blood system, white blood cell system, where it just offers host defense. And from there, we have evolved in our thoughts, we have evolved and identified the crosstalk between the brain and the immune system. And if you see, just take an example of COVID-19 as an example, we have really seen the difference between individuals. Like the blanket supplementation is no more working. Like initially, if there is an infection, a single vaccine shot would have been sufficient, or it have been proven to be sufficient for curtailing those infections. Or if there is a single diabetes mellitus per se, we just say it is because of our insulin insufficiency or resistance. However, we are not able to treat all the diabetics in the same way. Similarly, what we are facing an issue with COVID-19. All the COVID-19 patients are not responding in the same way. So there is something beyond what we just look into as a physical entity, or what we look into just like a mental entity. How we can link it together. So naturopathic medicine since beginning has spoken about this being holistic. So unfortunately, even most of the naturopaths or most of the higher systems of medicines, what we call in India, most of us have become more reductions than what is modern medical system is catering to. So we are also targeting a single receptor basis or single intervention basis of therapeutics, like how modern medicine has been catering all these days. However, if you see the homeostatic mechanisms inside the mind, there was study which was conducted with morphine, the highly known painkiller, versus a placebo in the war survivors in Spain, where we have seen the placebo performed better than morphine, just because of the reason the patients were reassured that this is going to be the world's largest painkiller which you can receive. Whereas the people who have received morphine does not show much improvement compared to placebo. So what is this inference just saying us? There is something beyond the bodily systems. There is something beyond what is called mind, or what is called immune system, or what is called mental health. The perception of a person regarding a disease, the perception of a person regarding a condition does matter. It helps the person to bounce back and recover back to the original state. So there is some set point which we call. The set point doesn't mean the conventional notion of normal blood sugar or normal blood pressure or normal cholesterol level. The set point is something where we feel we are okay, we are good, we are having complete wellness within us. That is even with your uncontrolled diabetes, even with your uncontrolled hypertension, even with uncontrolled whatever numbers you have, which is being given in your laboratory report, even with all those numbers going in disarray, still you are feeling good, still you are feeling well-being within you. Reaching that set point is something which helps the person to bounce back. And if you see inside the human body, the perception is never from the internal imbalance. It is just from outside as well. Whatever we are getting from outside, it has an impact on our health per se. So the latest part which is developed, like this paper is published in 2010, the emergence of new science of mind, that is immunological mind, benefits of mind, the role that mind can play on your immunology. Does your immune system is modulated by your mental health? Does your mind can play a role in bringing your immune system into a balance? The immunology of mind is largely ignored by most of the physicians, not even conventional, not even Irish physician, most of us. Though we say that yoga is there, we say that the Tai Chi is there, different kind of mind-body interventions are given. All these are given in a quantified manner. We always look for a quantified outcome, like reducing certain parameters, reducing certain levels of inflammatory markers. This is we all what we propose every time, and we always look for this quantified levels. And though we say that the alternative systems of medicine is that what they call is holistic, but are we holistic enough in the name which we claim? Our holism does not comes in practicality. When we just look into a person, like when you get like any of the eyes physicians, when a diabetes mellitus patient or even a COVID-19 patients come in front of us, we also look in the same parameters of bringing down the SPO or raising up the SPO2 levels or bringing down the infection levels or not needing the ICU. This is what our goals are also. But is this what is being called as holism? So when we understand the immunology of mind, when we understand the homeostatic potential of our body as well as the mind, the link between the body as well as mind, then we can really understand how to mitigate these factors, how mental health has an important role to play in immunity, and how immunity is being modulated by the mental health well-being. And here I want to introduce not a very new concept, but very important concepts, which is ignored largely by most of the physicians. And we don't consider this as a concept altogether. If you see epigenetics, so we all from our college days reading medical textbooks, we are abused our mind by means of genetics, the genetical component of cancers, the genetical component of getting metabolic syndrome, genetical component of getting any kind of diseases, autoimmune disorders per se. But we have never discussed enough about epigenetics. I feel being an alternative forum where we are not proposing any Pradeep to be the largest Pradeep or can be the superior Pradeep for treating the conditions of people. Epigenetics is something which every doctors or every healthcare provider should be knowing of and acknowledging the same. And epigenetics is some how our behaviors and the environment can causes changes in our genes work. This is where we have seen once in a blue moon we get papers reversal of heart disease, reversal of cancer, not by doing anything, just by being ourselves. So this is something which to do with the environment, our behavior with the environment, and how environment is behaving with us. And all these changes which we are seeing, like right from we are claiming that we have eliminated polio, we have eliminated different kind of diseases from the world. We are eliminating the names. The diseases are coming in different names. The very evident is the COVID-19 virus, SARS-CoV-2. The coronavirus was the reason for 40% of 40% of common cold and conditions related to that. This is not a new virus. Suddenly it has become so popular just because of our irrational behavior, the behaviors within us and the behavior which we have induced in the environment. Though we say that genetic changes are non-modifiable, but epigenetic changes which we acquire due to our behavior or the behavior from the environment are reversible. And it does not change the DNA sequence, but they can change how our body reads the DNA sequence. For example, the ability of a person to become diabetic or to become having a CA of breast is more because of familial incidents. That can be reversed by having a better behavior and better interaction with the environment. And this is what we are out there to do, not introducing newer problems to the environment. Environment is not, I'm just speaking about the trees, land, or the mud around us. I'm speaking about the environment within us. I'm speaking about the environment we contribute as a society. Like it includes how you think, how you shout at people, how much non-violent behavior we are having with others, how others are behaving with us, how much plastics we use, what we read, how much petrol we burn every day, how much petrol miles we travel in a year. All these things are linked to health. But unfortunately, for us, health means liver, heart, genes, spleen, or our nervous system. The health is contributed from outside. And other than naturopaths or other than holistic system practitioners, who else can understand this better? And right now, epigenetic modifications is increasingly recognized not by the doctors, by the environmentalists, because they understand the impact of the environment on the body. So we all have read this. I speak in almost all of my lectures, the epidemiological triad between the host, agent, and the environment. We are either host-centric or we are either agent-centric, but never environment-centric. When all these comes together, like how we have mind and our body is linked to the immunity, like what we are fighting today, when all these things come together, when we can have those kind of epigenetic changes inside our body, we can decide upon which cells to act on what kind of scenario. That is what holistic systems of medicine can bring. And as we all know, as physicians and as healthcare providers, there are two types of immune system. One is innate, another one is adaptive or acquired immune system. The adaptive immune system is modified by the epigenetic modifications. And if you see, the COVID-19 virus is having more escape mutations right now. It is just because they also have an adaptive immune system in their body. Whatever we give against them, they will come up with more resistant strains. And it is going to be more harmful for ourselves. So what we can do is like to develop a conducive atmosphere where COVID virus also can stay happy, human beings also can stay happy, and all of us having a conducive immune system. So the opening of my talk, I said about immune system is not just attacking against viral or bacterial invasions. Immune system is providing tissue repair. Immune system is providing good somatic response to the different kind of conditions. Conditions doesn't means that those which is present in international classification of disease. Condition means anything and everything which is affecting your mental peace, anything and everything which is affecting the peace of each cells in our body. So we all are made up of trillions of cells. And this publication, which you can see as a footnote in this particular screen, it is something directly linked to the therapeutic potential of epigenetic manipulation during infectious disease. It is not even a publication which came after COVID-19 virus. It is there long back. Only thing is it is already out there, but we are not utilizing that because there is no commercial interest in such kind of epigenetic modification which you can bring. And yoga and naturopathy physicians out there can right away bring in this kind of epigenetic modification, which can regulate the balance between viral latency and its replication. And it's out there, published literature. I've just copy pasted and given credit to whoever has published this particular stuff. And how we can bring in such kind of viral latency and preventing its regulating the replication of the virus, the number of the virulence inside our body, how we can reduce, how we can bring in a very holistic immune system within our body, just to respect the environmental signals. So once the human cell, like as I told, we are made up of trillions of cells, and it is considered as a structural and functional unit of our body. And each cells, like how we respirate, how we breathe, how we reproduce, how we digest food as a whole, each of our cells has its own internal regulation, its own internal digestion, its own internal respiration, its own internal reproduction. And any one of the cells in our body, if it is not happy, it will be just looking into, it will just like how if a neighborhood is not happy, how it will be disturbing our happiness inside our house. It will be slowly, that happiness will be deteriorating across the village. How this is happening in similar fashion, it will happen inside our body. It is not like that if you get a cancer in your breast, it is just the cancerous cells are present in your breast. That disturbance might have started somewhere else. And it is for us to identify as a whole rather than just looking and aggressively targeting the breast cells, radiating it and removing it, or giving chemotherapy for such kind of cells, until and unless it is a kind of a life-threatening emergency. But we don't give the opportunity to the body for itself to respire normally, digest normally, and come back normally. And we just go with the concept of nucleus as the control center of the cell, but it is no more the control center of the cell. It is considered as a gonad, which does not have any function other than reproducing into multiple cells by cell division. Right now, the cell membrane is considered as the building block or something which is equivalent to that of the nucleus, because the cell membrane, which is present everywhere in the body, inside, outside, everywhere, wherever you see, there is cell membrane. The stimuli, the cell membrane which is receiving, which is a conducive stimuli or a non-conducive stimuli, that will be actually deciding upon which gene to get activated, how many cells to be divided, how many replication of the cells should happen inside our body. It is all decided by the perception. So it is not just the virus, or it is not just the insulin resistance which is happening overnight, which is making you sick, or which is making you more vulnerable to infections or non-infectious disease. It is a constant trigger from the environment, various type of environment. Like if you open TV, there are hundreds of news you are receiving about people dying, not about people recovering. There are hundreds of news. You're getting what comorbid conditions like diabetes, hypertension can do if you have comorbid conditions, what coronavirus can do within your body. So these kind of perception is also received by your cells. Your eyes are made up of cells, ears are made up of cells, and that is processed between the brain and the peripheral immune system connection. And you see, this is published in 1988, which I have said, the origin of mutants. How the mutation is happening? Mutation is not something which is just happening in a random fashion. Mutation is pre-decided. Mutation is pre-decided in such a fashion that how you are responding to the environmental stresses. Over a period of time, if you just look into, over a period of time, if you just hear negative news, like we have started hearing about, well, I'm taking an example of COVID-19 from 2019, we are just listening about COVID-19, its wild, disastrous notion of COVID-19, and it reached its peak in the second wave. Many of the people have got affected, and later people got. Later people got understood about how the mental health can have an impact on your infection, how mental health can have an impact on determining what kind of mutation should happen in your body. These environmental stresses are the majority of the reason. And you see the publications which come, it is published in Nature, and the publication which come in the previous times, like I'm saying about before 90s, those non-biased publications where the answers are already out there. Only thing, because we are hungry for expansion of science, we are hungry for simplistic approach. We don't want things to look complex. And complexity doesn't mean in the real sense it is complex. It is networking. It is like multiple causation for a single thing. And we don't want multiple causation or web of causation for a single phenomenon. We want always a target-centered approach. And its perception, what we have is what something which is triggering our body, and which is triggering through our sense organs, which is the principle in charge for the genetic change. Even if you are getting an acquired infection, it is your genetics which is bringing it is your epigenetics which is actually bringing that change in you. It is not that your immune system is weak, you are getting. We have seen a lot of people who are lesser immune, who are living in slums, who are not having that so-called sophisticated hygienic measures which we are using. The most sold thing in the pandemic was the hand sanitizers. So it is all in the mind. It is all in the mind whether we get an infection or not. If you are more vulnerable, if you think hundreds of times that you are going to get diabetes or you are going to get an infection, you are out to get it, because you are preparing your body in such a way with a lot of environmental trigger. But this is not studied, this is not properly explained. Like if somebody speaks in this manner, they'll be asking where are the randomized control trial to prove this concept. Everything cannot be proven with a randomized control trial or trial designs. There is something beyond such kind of design studies also. It is not a drug which we are just intervening. Mind is something which you are harvesting over a period of time by yourself. It is not something which you can induce by any kind of medications or any kind of meditation or any kind of practices. Mind is something which you all can cultivate, harvest, and this is what we should be teaching our patients. This is what we should make them understand. The health cannot be outsourced. The health cannot be brought from the doctors. The health should be in source. It should be developed within the body. And how the moral responsibility remains with each doctors, the similar moral responsibility remains with the patients as well, in the way they treat the environment, both the internal environment as well as the outside environment. And as I told, it is from more than 2-3 decades such kind of factors are being there, but we are ignoring such factors and just moving ahead with our reductionist approach, where not only modern medicine, even the so-called Ayush systems, we are introducing receptor-based approach, which is very well against deviated from what we are learning in the basic principles of our respective disciplines of Ayurveda systems. And if we just see how mind or the environmental stressors can have a change in your immunity, and thereby have a change in your kind of different kind of diseases what we have. So this was published by us in a chapter called Stress, which I wrote for one of our textbook. And if you see, there are different kinds of stressors. It can be a physical stressor, mental stressor, environmental stressor, which come into us. Whereas it can have initial stimulation with our sensory receptors, initial stimulation in our brain, and the brain processes it. And how vulnerable your brain is, how vulnerable your brain in terms of the continuous stimuli you are getting. That if a person is telling that you are brilliant, you tend to believe that you are brilliant. If a person is telling that you are not brilliant, over a period of time, you accept that fact that you are not brilliant because somebody is repeatedly saying that. Similarly, you are prone to infection, or your immune system is weak. You need to have these immune boosters to have more immunity. What is more immunity? How we can quantify more immunity? Or what is a perfect state of mental balance? These two things cannot be quantified at all. It is very subjective from person to person. However, these subjective changes within you, how grave these changes which you are developing, the hypothalamo-pituitary axis will be stimulating your adrenal glands, and it can create all kind of changes inside your body. And diabetes mellitus or any kind of psychiatric disorders or any kind of mental health illness are not anymore just treated as something which is related to only brain or something which is related to only your metabolic organs. It is linked to everything. Whatever you perceive, if you perceive it continuously, there can be excess gluconeogenesis. That can be glucose production, can be from any kind of things. Like it can be produced from the proteins, it can be produced from the fat, it can be mobilized, and eventually we will be called diabetic. And glucose secretion or excess glucose secretion is normal for any kind of stress. The flight and fight response, which we call normally in physiology. If you are continuously threatened, or if you're just threatened, there will be an excess secretion of glucose. And if you are continuously stressed, the secretion is going to be continuously there. Similarly with neural excitability, similarly with your cardiovascular activity, similarly with your gastrointestinal tone, like what you get as an autoimmune disorders like an irritable bowel syndrome is an outcome of the continuous stress what we are getting in different forms. And the deferred immune status is something which triggers this. And we all are discussing in a large way after the Human Microbiome Project in 2010, the role of gut microbes in creating this kind of immune changes, differing the immune status. And we also speak about gut-brain axis, how our gut can influence our brain, how our gut can influence our thought process. So when there is more inflamed bacteriums in your gut, you're going to produce more inflammatory diseases. Rather it be autoimmune diseases or immune disorders, doesn't matter, we are going to produce that. And why I'm speaking more about these concepts, because it is very relevant that it is very important that all of the Ayush physicians should forget practicing just diabetic centric or hypertension centric or mental health centric or any kind of specific disorders or system centric practices should come to an end. Who else should bring in the holistic approach in the society, which was already there? We, like me, especially being from India, we are very proud of the traditional systems of medicine. But the moment the traditional systems of medicine has become a legal practice in India, it is slowly deteriorating, it is slowly losing its charm just because we are diluting its vigor. We are diluting the original traditional concepts of the traditional systems of medicine. And we are having a philosophy-less practice. I always say the modern medical system is very strong with their philosophy, that is reductionism and symptomatic approach. Whatever symptoms, treat the symptoms and give the temporary relief to the patient. Whereas we, as holistic system of medicine, we are also following a reductionist approach. We are more reductionist, I would say. Like if I give this example always, if reducing the blood sugar or bringing or boosting the immunity is what that we are intending to do, the similar thing can be done within minutes by an allopathic drug, by a modern medical drug. Then why we are as a substitute over there? Let us not become the substitute practitioners. Let us not become the adjunct or ancillary practitioners. Let us be the primary care providers where we can treat the patient from the root. We can treat the patient from the very cause of the disease. That's what I'm saying, the epigenetic changes which is induced in our mind and body. The belief system which is built by the so-called medical system where we all are a part of. Until and unless we move to that kind of direction, this is just going to remain as a theory. And when we bring the naturopathy concepts into this particular concept of mind, body, and immunity, naturopathy concepts are very beautifully said. There are only three causes for a disease. It can be either a lowered vitality or accumulation of morbid matter or toxins, what we call in naturopathy, or abnormal composition of blood and lymph. And there is no precedence to any one of this particular thing to happen first, whether lowered vitality happens first or accumulation of morbid matter happens first or abnormal composition of blood and lymph happens first. It can be happen in any fashion. And what is called vitality, again, we don't have to jump into quantifying vitality or don't have to jump into putting what is morbid matter, defining it, not necessary. Vitality is something, your ability to cope and be resilient about anything which is happening around you. Whether you can properly conduct yourself in midst of all these crises which is happening around us, that is called as you are in an optimum vital stage. That is something similar to kind of a wellness stage. Like we cannot define disease, we cannot define health, because disease, if you go with WHO definition, it is very dicey. It is physical, mental, social well-being, which we cannot quantify, which we don't want to quantify. It is all about you feeling good. It is all about you feeling you, in the sense through you, your patients. And whenever there is a lowered vitality, whenever you are feeling low, whenever you are feeling vulnerable, whenever you are not able to cope up with whatever stressors are around you, that can lead to an abnormal composition of blood and lymph for a transient phase. If you can bounce back, as I told, the body homeostatic mechanism gives an opportunity for every individuals to bounce back to a set point where you feel happy about where you are. Even with a cancer, you can have a good quality of life. You can have a proper high vitality. I'm saying vitality is very higher concept than just immunity or just having a low blood, less having a normal blood sugar or normal cholesterol levels. It is very much above that. Even with a high cholesterol level, even with a CA of breast, we can be having a very high vitality. So that our entire bodily parameters, which is not quantified, it can be anything. A person with 400 of blood sugar level also can have a very good vitality if he feels so that he is doing healthy. And I have live examples of patients in front of us who doesn't look for any kind of conventional thoughts. Actually, we overdiagnose a patient and make him sick, which will be affecting his immune system, and all the kind of disorders will be starting from there. So this is something which is similar to the epidemiological triad, where host, environment, and the agent contributes together towards a disease or management of disease. Similarly, the vitality, the accumulation of morbid matter, and the abnormal composition of blood and lymph, which is need to be corrected in a person's body in a holistic manner, not just giving an acupuncture, not just giving a metformin to correct all this together. And this is something which always we should be reiterating, that health is not the absence of disease. That is a very wrong concept, that if there is no disease, you are healthy. And it was one of the most critiqued definition, even the WHO's definition. If you can see the publication down there, you can understand the current definition of WHO towards health, where we all follow religiously from our social and preventive medicine textbooks, contributes to medicalization of the society. If you look into the entire definition of health, we'll be just taking one component, that is like around 90% we'll be treating physical health as a substitute for all the other parameters, and mental health, thanks to the tools which have developed, Hamilton's depression scale, DAS-21, anxiety and depression scales, where we just use for quantifying our feelings. It is not the patient want us to quantify their feelings. It is we doctors want to quantify their feelings and let them know this is your number, and just let them know that this is the number which you need to try and achieve. That is putting the patient into tremendous pressure, and on a longer run, he'll be just thinking about his sickness, not about his wellness or achieving health. So absence of disease is never considered as a definition for health. And also the 2010 that international conference that experts has recommended, the resilience or capacity to cope and maintain and restores one's integrity, equilibrium and sense of well-being is something which should be considered as a component to define health. But since we are always trained in numbers, we are not ready to accept such kind of definitions. But I'll strongly recommend the entire Ayush fraternity at least to take such kind of definition, where this is beautifully published in 2014 in Journal of Public Health Policy, how health can be beautifully defined in multi-layered approach. Health is a multi-state well-being emergent from conducive interactions between the individual potentials, the life's demands, the societal and environmental determinants. As you can see over here, there are a lot of demands of life placed in a human being when he's born. The demands can be inducing eustress or distress, and these demands, how we are able to negate these demands, the individual demands which we have, the societal demands which we have, and the environmental demands which we have, how beautifully we can negate these kind of demands is what define we as an individual and define how healthy we are. And this is one of the strongest recommended paper for all of you out there who are listening to read if you want to have a fruitful healthcare practice rather than disease management practice. And let us stop disease management practice and abusing people. And as I told, there are two types of potential which an individual has. One is personally acquired potential, another one is biologically given potential. So the biological given potential is something which represents the biological basis of life. That is, which is developed from your cell division, which is happening inside during the pregnancy. And how this biological given potential is shaping inside our body depends upon how a good quality pregnancy we are having. Unfortunately, we have abused pregnancy also. The number of C-sections is around 75 to 80% in the country across the globe. So until and unless we have a very quality or conducive pregnancy, that is where the healthcare providers, childbirth educators, a role is a large in building, in shaping a healthy nation, in shaping a healthy world. And the epigenetic regulation is very important in terms of pregnancy because that determines how healthy or how immune a baby is coming out. At birth, this potential is very high and it reaches zero at the time of the death. When the biological given potential becomes zero, we will die. However, the personally acquired potential can be at the peak even at the death. That's what I'm saying, like having a happy death, having a peaceful death. So sometimes we have developed an aversion towards death. We have developed an aversion towards pain. This is what have created a medicalized society. Because we cannot tolerate the natural course of a disease. If a disease can naturally end up in 7 days, we want to end up it in 2 days. If a disease can be naturally reversed in 1 month, we want to reverse it in 7 days. The shortcut mechanisms which we are just inducing is an environmental abuse. It's a stress to the body, which is actually hindering the mental health balance as well as the immune balance inside our body. And the immunity starts from the gut flora, and the gut flora development starts from your pregnancy, where the epigenetic relationships from the mother, what the child is receiving during in the womb, determines how much biological potential the person is having. And every somatic disease, like any kind of disease which we are encountering due to the course of life, any injury, any defect, any kind of stress which we are receiving can diminish the biological given potential either transiently or permanently. People who are dying a premature death, it is not because of they are having the disease, the biological given potential is reducing. This is what we call vitality in naturopathy. And the personally acquired potential is something which we acquire like the acquired immune status. Once you come out, our brain, our systems start maturing, and we develop the personally acquired potential by having good support system. And this is very important, and this is the area where exactly the medical fraternities can contribute to being a better support system for the patients. We don't want to call them as patients, let us call them as health seekers. Being a better supporting system for the health seekers, not something which we are superior far away and there is a big wall in between the medical practitioners and the health seekers, and the health seekers are always ignorant about the true nature of their body. We have successfully kept them away from the true nature of the body. That is why we are facing all such conditions, all such problems which we are facing. And I'm saying that the alternative system of medicine practitioners will not lose job, or there will not be any economical crisis by doing such kind of noble deeds. Ultimately, people's look out for health is always there, but they are not getting the right person who can guide them to reach the optimum health, which we can transform the entire society. And how this supporting system, like if you are hearing bad things, your personally acquired potential is going to be bad. If you are hearing good things, if you are shaping your mental health very well, the personally acquired potential is going to be really good. And this both will determine how long and how qualitatively a person can lead their life. And if you see the next picture, many of you have attended my previous sessions might have already seen this. And these two lines which you can see in my cursor, this represents the biological given potential and personally acquired potential. Normally, at birth, the biologically given potential is very high, as I told, because you are so vibrant, you have high vitality. And due to our abuses, if you abuse it continuously, or if you are succumbing to the environmental pressure, gradually we will be reducing our biologically given potential and it will become zero and we will die. And at the same time, even if you consider this as a geriatric age, you are born, here it is 0 age and here it is 90, you're obviously going to have a peaceful death, because the personally acquired potential, your morale, your look out for the world, look out for your own self is very high, and you are not worried about dying, you are not worried about having any kind of diseases. Your personally acquired potential can be very high. This is what we call quality of life. And most of our patients are having a lesser quality of life and dying prematurely. And if you see the people who are dying due to cancer, dying due to myocardial infarction, it is just because we are curtailing their personally acquired potential and they have an early death in before what is their lifespan, which is normally pertaining to. So our goal is to make people achieve the personally acquired potential to be as higher as possible, so they can they can cope up to any kind of pressure, any kind of mental traumas which they are put into. The similar one which we have over here, the COVID-19 crisis also. Let us not being a prescriber of certain kind of medications, certain kind of herbs, not just be a prescriber of all these things. And let us do this prescription for a better cause. Let us do this prescription for a larger cause, where our goals are clearly defined in terms of philosophically and scientifically empowered concept, not just the concepts of having a reductionist approach of having free of infection. We can never be free of infection. We can never be free of diseases. All we can be is having a strong vital power, strong willpower to cope up things. This is what I look out as a mental health, and it will be acceptable by almost all the public health experts. And let us understand the notion of disease and health is very highly context dependent. It differs from person to person. It depends upon your affordability. If I am a person who cannot afford to fall ill, I won't be falling ill, because I know that I have family to run. I cannot lie down if there is a small headache. I cannot lie down if there is a small backache. But if I can afford to be ill, I can directly go and have my MRIs, have my CT scans, and I can just take rest for 1 month in a sophisticated hospital. So it depends upon how much support you have, how much you are convenient and conducive to become illness. So this is a concept which is being published in EMPO. What is disease? It's a very beautiful paper. And what counts as a disease to someone does not sound as a disease to somebody else. If you see the exact lockdown crisis what we had, most of us who can work from home, who had a kind of an IT job, or who can just run some businesses from home, they were comfortable running businesses from home. There were some kind of crisis, but it was not major crisis. And those were the people who were wearing masks and using sanitizer and sitting inside home. The people who cannot afford to stay inside, who have to come to the ground. Like, let us see the migrant workers conditions in India. They just traveled. They just traveled from Tamil Nadu, Kerala to Bihar, Haryana, wherever they want to travel. And there were no reports about them. There were no reports about the infections around them. There is nothing available around them. And we can still see people who are roaming around without mask. We can still see people who are roaming around, because the perception does matters. Irrespective of whatever policies, whatever your medical textbook says about a particular disease, or how a virus behavior in your imagination under your microscope, it is not going to be true in a social context, in an anthropological context. Let us be more anthropologically and socially empowered physicians, rather than just empowered by medical textbooks or what we read in 5.5 years in our medical schools. So let us understand the ground reality. Let us understand why there is an increasing expectations of health. It is just because the diagnostic ability has been increased. If you see long back, if you don't have, this is a statistics I'm saying, which is published. The countries which has tested, which has done less number of tests, less number of vaccination, had less number of mortality rate. YCB, the mortality rate of COVID-19 is less than 1%. The more we are doing sophisticated diagnosis, the expectations of the people are increasing. The expectation of people are increasing because we are catering them that kind of informations. We are catering them, we are scaring them. If a person is doing yoga, we are giving that yoga for a reason that he should not get diabetes. So his ultimate goal is a negative phenomenon, that is diabetes. How many of us are giving positive affirmation to our patients? How many of our people are not speaking to our patients about disease? Every one of us speak in terms of disease. Irrespective of anybody, whether you are an allopathy doctor or a naturopathy doctor or a homeopathic doctor, doesn't matter. We all speak about disease. And we are in a very dire need of diagnosing people. We are in a dire need of diagnosing and putting a name for, this is a diabetic population, this is a hypertensive population. And this is going to have a very large mark on their mental health well-being, and that is going to cost us a lot. And when are we going to think mind and body as a single component? Though we say that we are mind-body physicians, are we really mind-body physicians? And there is a strong relationship, and these are all there, like papers, if you want, there are hundreds and thousands of papers which says that how to do things, but we exactly do it the opposite way. The hypothalamic pituitary adrenal axis dysregulation and the risk of developing psychiatric diseases and mental health illnesses has been already known. But what is interesting is the peripheral disorders like metabolic syndromes and other cardiovascular syndromes are also associated with the hypothalamo pituitary and adrenal axis, which is mostly emotion-based dysregulation. Any emotions can create metabolic disorders. Any emotion can create infectious disease. Any emotion can create any kind of disease you want. And there is a significant inflammatory component in all the kind of diseases. And the inflammation is triggered by epigenetic informations, the environmental triggers which are shown in that particular figure. So until and unless we just go and understand this fact, where mind and body is a single compartment, though we know this, we don't utilize this particular information to a larger level. So this inflammation and HPA, hypothalamo pituitary adrenal axis dysfunction, is something which is leading to psychiatric pathology, as you can see all over here. And it can desynergize the neuronal function, and all the kind of disorders and diseases, starting from mental health illness to systemic disorders, everything is something which we will become more susceptible when we are more stressed about that particular thing. And let us understand the ground reality. We as a human being, how we react to a stressor, the same way an infectious organism also react to a stressor. Whatever you are giving, maybe an antibiotic, maybe a vaccination, maybe a herbal product, if our mind is thinking in a way that we are going to distract this particular organism, the organism will also think in the same way, because they are parasites. They think from your body. The viruses take nutrition from the body. The viruses take information from your body. And they also think alike, like how we think in the same manner. That's why we are getting a lot of escape mutants. That's why the thin line between the mind and body should be very well regarded, at least by the Ayush physicians, because your traditional concepts are in that same way. And long back, there is a concept of unity of disease and unity of cure, which is given by Louis Cuny, about how there can be a single cause for a disease and how there can be a single cure for a disease. This is one of the concepts in naturopathy which is mostly abused just because of the reason that we don't understand it properly. So let me define it with a concept of health, which you can see in the black letters. It's a balance between a person, the environment, the unity of soul, body, and the natural origin of the disease, which was the backbone of perception of health in ancient Greece. So Greece guys are known to be the pioneers in healthcare, because all the Greek gods are considered as the panacea of cure. And if you see the balance between the person, the environment, the unity of the soul, the body, and the natural origin of disease, these all put together is the backbone of the perception of health. But we are treating all these things separately, all these things in a way which we want to treat. And if you see what is unity of disease and unity of cure, which is discussed in naturopathy concepts, and this is also published, as you can see down in the papers are mentioned, the individual factors. I, as a person, disease occurs at the last moment. What we see or what we diagnose, what we look in laboratory, your RT-PCR reports, all are the end stage of the story. It starts from the individual factors. The moment you hear about COVID-19, mucormycosis, and whatever related things, we are now scared about the third wave, where it is already predicted that children are going to affect it. These all are the something which I call as individual factors. How you are vulnerable to the environmental factors around you, how you are vulnerable to the stresses around you. These individual factors contributing along with your environmental factors can stimulate physiological disarrays, which you can see as either a fever, which you can see either as a raised blood sugar, blood pressure, inflammatory markers, whatever you want to have. Then there are our role, the doctors, who can name it as any kind of diseases which you want. And treating the agent, treating the physiological factors, treating the environmental factors individually is not going to create any kind of change in the individual factors. The root cause of the disease, what we all call proudly in naturopathy, is the individual factors changing the perception, the very perception of the person about the disease, the changing the perception of the person about the environmental factors, his role in shaping the environment, his role in shaping the physiological factors. This is what is called unity of disease and unity of cure. You give any name of any disease, this is how it is going to look like. Let it be an infectious disease, let it be a non-communicable disease, it is going to be the same. It is going to be this individual factor which is slowly migrating up and what is manifesting as a disease, and we name it. And if you see the present day approaches, these are all, as you can see in the screen, it is scattered. If you see pharmacological interventions, they are just interested about the receptors. If you see the herbal formulations, they are targeting immunity. And there are immune boosters by themselves itself. You are just targeting immune system. If you look at the yoga physicians, yoga naturopathy physicians, I'm not saying who are not practicing, but most of them, they are just looking, they are interested in only vagus nerve stimulation. And if you look at acupuncture practitioners, they look for meridian imbalance. We are in different island. We are in no man's island. Until unless we integrate all these practices together, we don't, until unless we connect these dots together, we are not going to achieve the so-called health, which is not defined by absence of disease. And going further, if you just want to see how mind and body is linked, it is so complex like this. And it is so complex and beautiful like this. There is nowhere nothing is delinked. There is nowhere nothing is not linked. Everything is linked towards each other. If you think brain starts first, it may be brain. If you think that it starts from the abdomen, it starts from the abdomen. If you think that it starts from the lymph node, it starts from the lymph node. treat everything with respect, treat everything equally with respect. And the only way to treat everything together is to just come out of that compartmentalization of practice of your super specialization. There is no need of super specialization when your body is made as a single compartment, and the mind and body is integrated as a single compartment. Until and unless we are in dire need of money and we want to be one among the reductionist practitioners, let us not do that particular thing. If we don't understand that kind of thing, if you just scatter your approaches, the body is linked like this. You cannot target a brain receptor to treat something in your abdomen. You cannot treat something in your abdomen to treat something happening in the brain. You need to treat both together. You need to, instead of calling it treating, you need to respect both of them together. That is what is called the mind body balance, what we are trying to achieve. So this is what we have proposed in a paper published in 2020, which is relevant to all kind of diseases. If you see the stress, poor dietary habits, lack of physical activity, and the environmental causes, which I call as epigenetics, is the reason for the lowered vitality or abnormal composition or toxemia or altogether. And that can in turn causes the bacterial dysbiosis, which can be disrupt your circadian rhythm, which can have certain kind of metabolic dearrangement in the body, which will lead to systematic inflammation. That we can call it as in any name, but the names which you have seen in the stage 3 is not the focus of any yoga and naturopathy physician. They focus rather on bringing a homeostasis in hypothalamic pituitary axis, or bringing the much needed genetic expression changes by means of correcting the epigenetic triggers, reducing the oxidative stress and inflammation, bringing a good balance in the neuroendocrine pathways, your BDNF levels, bring it in a normal way, bring good bacteria active in your gut, thereby regulating the immune system and thereby improving the adaptive immune responses in the body. And you can have any name for your disease, it doesn't matter. This is the line of approach what a true holistic yoga and naturopathy physician will put forward in a patient to achieve the much needed balance between the mind and the body. So that's all I have for the day, and thank you, Open Attempt, for this opportunity to interact, and looking forward to great association in the future as well.
Thank you very much. That was great. A very dense and informative presentation. So you took us from the whole idea of, basically what I take away is maybe everything is some kind of information, be it food or emotions or ideas, thoughts, whatever may come there, and it will be, there will be some influence on your system. So, and by that way, to the end, where you showed us, the ways you are treating people, but on a different note, you are not saying we should not use medical approaches. You are saying the whole approach to whatever you are doing should be different. So you can use medicine, you can use injections or pills or even radiation or whatever in cases where it might be needed, but you need to develop a different approach to it, a different understanding of whatever you're doing, not only as a patient, but also as the doctor who is doing this. So, I mean, I hope this is about right of what you were presenting here. Or did I mean, or is there something, is there any kind of, medical treatment that you would not see as a good thing, you would say no to?
So I would suggest like nothing. I would say no to any kind of treatments per se. But what I would be saying is like the approach. It is actually a juxtaposed approach is what we should approach. Like it should not start with medications or drugs. It should start with giving an opportunity to the body to heal. And if that is not working, and most of the disease, 90% of the diseases can be cured or can be managed. I am not using the word cured again, can be managed by giving an opportunity to the body to do that kind of healing, because body has its own wisdom to heal itself. And it is all about how we as doctors and practitioners just empowering the patients through this concept, because patients come in front of our office or our clinic just expecting some kind of medications from us, and that kind of thoughts is being imparted in their mind by we doctors, starting from family physician practice, and we all aspire to become doctor by seeing somebody giving medication and getting respect, and we don't want to replicate the same. There is nothing to call wrong to call you as a traditional medicine practitioner. Traditional medicine practitioners having equal respect, in far more respect than what conventional medicine practitioners are having. Like you treat incurable, or whatever is being treated and worsened, it will be sent to the centers of yoga and naturopathy mostly. So we can be proud of, and I would recommend everyone to come out of that adjunct practice and get into primary practice. If you get a fever, let it be Ayurveda physician or yoga physician or a Siddha physician who treats them first, because many a times fever does not need medications. This is what I'm just trying to put forward.
Yeah. We have a question from the social media. Where should one start if one is not mentally sound?
Again, that is again a very subjective thing, like mental soundness. Like I'll be abnormal to many of the people who consider the other part of the story as normal. Like this guy is speaking against whatever is being believed by us, most of us. So abnormalcy or normalcy is a concept of philosophy, and the beauty lies in the eyes of the observer. And what you look as normal, and that mental soundness is something which we have to define ourselves. It is always comparative sampling, right? You just like me, maybe we say you are looking normal to me, I should compare and aspire to become like you. But that is not necessary. Let us not do that comparative thing, which is what has been happening across the globe. So you can start from wherever you are right now. That's the best position you can be in, and get a help of a holistic practitioner in True Me, and you will be doing good in no time.
Okay, so just as a final one, because this was a huge complex thing that I would actually recommend people to just go back and watch it again. We'll have it up there on YouTube and Facebook. So because it's a real fundamental approach to everything. Basically, it's not just a medical approach to health. It's just a all around way of life, actually. I really wanted to give you some time for you to explain, because we were talking about your own organization, and maybe you would want to say a few words before we finish this setup.
Thank you, Vishal. Actually, so I represent two organizations per se. So the first one, my primary employer is Sant Hiradaram Medical College of Naturopathy and Yogic Sciences for Women. So where the college was established based on this particular concept, where we create physicians and send them across the globe to spread this concept. So that is one where I'm coming from. So where we offer 5.5 years BNYS course, that is Bachelor's in Naturopathy and Yogic Sciences. And I represent another one which I founded because of this Talibanic concepts which has triggered me, that is Indian Academy for Scientific Writing and Research, where we're a group of physicians where we help people to develop such kind of concepts and train people basically in scientific basis of naturopathy and things like that, where you just said some time back that this is not something which is hardcore medical, and unfortunately medicine today is without philosophy. Whereas philosophy less medicine is a headless chicken for me. It should be the philosophical. Like if you see, like Vinayak, you should agree with me. The Vata, Pitta, and Kapha is long back gone from Ayurveda, and now it is all about formulations. Similarly with Siddha. So similarly, the philosophical concept should deeply root into every physician's practice in their day-to-day practice. That is what we train at Indian Academy of Scientific Writing and Research. We help people to write papers, conduct research, develop research organizations in their own institutes. That is what we do. And I think that is enough for myself.
All right. So that the website we will put in the link. Maybe you want to say the website where people could go to.
Yeah, www.iaswar.com, iaswar.com is the website, and also you can put the shmcnys.in, which represents our college. That they can contact me through that, and we'll do many more such kind of workshops. For the people.
Great, great. No, we will have the links. Um, presentation today, and you hear me?
Yeah, yes, no.
Thanks for today, and we hope to see you at the Knowledge Festival, 16th to 22nd of August, and everyone else too. Thank you for being part of it, and see you next time.